Good morning. Welcome to WHS 11 Great Day Live, our Monday Makeover segment. I'm Dr. Julene Samuels here in Norton Commons. This is Mindy Montano. She is one of my trained nurse injectors, and today's subject is Botox. So we're going to be talking about how we use Botox in a very artistic fashion. What we are looking for and what we're trying to achieve is, of course, easing of the lines of facial expression. The forehead lines, the frown lines, the crow's feet, typically. So we look at this anatomy and we know that this muscle that causes transverse lines of the forehead raises the eyebrow. The eye muscle that goes around the eye, when we use that muscle, we create crow's feet. We also see this portion contracting and pulling the brow down. The frown line muscles can also pull the brow down in the center, the medial aspect, the very inner aspect of the brow. So with that in mind, we're treating patients to try to ease lines at rest of the forehead, the frown, and the crows. Today, Mindy is not just my trained injector, she's our patient. So Mindy, we're going to do today, if you'll just look at the camera, raise your eyebrows. We're going to do a forehead treatment, a crow's feet treatment. I'm going to put a little bit right here to tilt the tail of the brow up just a hair so that the high point is here, not in the middle. And this, of course, is part of the frown line treatments. So we'll get that done for you. Any requests?
You know, I have a short forehead, so we have to go high, and I do pull a little harder on the left side.
Yeah.
Yes.
So we've touched on one of the most important facets of a successful and artful Botox injection experience for the patient, and that is anatomy. So the relevant anatomy is something that I always think about when I'm injecting fillers or Botox. And this is the anatomy that matters. This is the frontalis muscle of the forehead, which causes the transverse lines, but it also is a muscle that elevates the eyebrow. So we have to remember that. These are the frown lines muscles. When these muscles contract, we get the 11s. This ring of muscle around the eye is called the orbicularis, and that's what causes the crow's feet. It also causes depression of the outer part of the eyebrow if it contracts between here and here in a powerful squint or smile. So, and these muscles are what cause the bunny lines on the sides of the nose. So it's important to make that evaluation and to talk to patients about the opportunity to shape the brow as you're doing forehead Botox or frown line Botox. And that's an important part of the evaluation as well as the injection to avoid that surprised or artificial or not properly animating look that all patients fear. So make sure that your injector is fully trained and knows the anatomy. Surgeons are anatomists, so it's easy for us so that you don't fall into one of those pitfalls. But thanks for joining us for today's segment. For mentioning Great Day Live, we would be happy to offer patients a complimentary consultation as well as 10% off of their Botox services and 50% off some of the eye products that we use around the eye, like the serums, the creams, or even Latisse. So thanks for joining us. We hope to see you again soon on a future segment.